Hi, my name's Elise. I'm a pharmacist at Brashears Pharmacy.
Hi, I'm Kim Regallo. I'm one of the account executives for Mederi Home Care.
The primary thing that I'm responsible for at the pharmacy is what I guess you would call operating procedures. So if you have a smooth experience down at the pharmacy, if start to finish everything goes off without a hitch, that means I did a good job. If things have a hitch, don't call me, call my husband. No, I'm just kidding.
My role with Mederi Home Care is I help coordinate home care for patients. If they show an interest or I get a call regarding a referral, I come speak with the patient, kind of give them an idea of what to expect, let them know what their insurance coverage, what type of services they will need, and just help it be as smooth of a transition as possible, whether they're coming home from a hospital or a rehab or just simply needed that extra service in the home. One of the things that I enjoy doing and I get frequent questions for different resources in the community, whether I may know about how to get in touch with Meals on Wheels or getting some medical equipment like walkers, things like that, even knowing how to make possible transportation options and other things that they may not have that availability for. One of the things I was able to help some of the seniors is actually with Brashears. A lot of the patients for say in Inverness Club, they don't have the transportation. Always a challenge for people that live in like senior apartments or assisted living. The option is there that they have delivery for their medications when they need it. They're able to get them filled. Brashears wonderful with that. They've been a helpful resource every time I have called. We are also coordinate vaccine clinic yearly for them, and the residents at Inverness Club absolutely love it because they don't have to worry about trying to get to their physician, to the pharmacy to get those. It's right there. They have a clinic there. It's all coordinated. Consent forms are all filled out. It's no extra charge to them, but it's a nice little amenity that they don't have to worry about trying to get somewhere and they get the vaccine coverage that they need for the season. So
Yeah.
definitely thank you to Brashears for coming out to do that.
So sweet. We actually started a full-time delivery program right around when COVID started for a number of reasons. We had kind of dabbled with delivery before then, but when COVID really hit, we said, we've got people that are afraid to come out. We've got people that have transportation issues like you mentioned, and we said, let's just do this full-time and let's really kind of ramp up how we're doing it so that it's really coordinated for patients. So we delivered to a number of patients, like Kim mentioned, at the Inverness Club, and file all their deliveries together. We're in and out super quick. Do that throughout the community too. So we've got a driver that will deliver to all the different zip codes near us, and she's got that routed out. With our medication synchronization program that we run, a lot of those patients are just getting a once a month delivery of everything together, and it's really nice for the patients.
Makes it easier too because I've seen them like in the pouch. They're pulling that pouch out and there's no guess as to what they're supposed to be taking. And some of them with the visual, the visual problems, that is a challenge to make sure that they're taking the right medication. Oh, in case you don't know what the medication synchronization program is, Elise.
Okay, I can explain that a little bit. We actually offer two different things with our medication synchronization program. The first is I'm just a regular patient. I want traditional vials, but I want the convenience of only coming down to the pharmacy, either once a month or once every 3 months. And we will take all of their medications that they have and basically line up their refills and then almost do like a concierge type service where from that moment on, we are going to have dibs on their prescription the entire way through the process. We're going to fax our doctor and coordinate their refills. We're going to make sure if they're on special order products that those are in stock, ready to go. And then if they want delivery, then they'll go out for delivery or for that once a month pickup. And then there's the medication packaging component that we kind of call an add-on, where you said, hey, keep doing all that concierge work where you contact my doctor, you track all of my medications, you keep everything in stock, you line it up together, but will you help me figure out how to take them too? And that's where the medication packaging component comes in, where we say, hey, let's make this ideal for you. So we've got your evening meds where they're supposed to be, your morning starting meds where they're supposed to be. It's easy to read, it's easy to see, and it's really helpful both for our seniors who, sometimes they have trouble keeping track of a handful of medications. Did I take this? Did I not take this? It makes it really easy to track that. It's also just really convenient. So sometimes we think about it as just for seniors, but it's also super convenient. We do vitamins too. So for somebody who says, I would really like all of my vitamins packed, we'll pack vitamins for people. It's a game changer for sure.
And quite honestly, with home health, our goal is to promote as much independence as we possibly can and keep them in their home as long as they can. And that's one thing that does help keep that independence, create that independence. They feel confident with taking their medications. We feel safe when they demonstrate that they know how to do that and are taking them appropriately. So it's just another little extra tool to try to keep them safe and not overdosing themselves or taking the wrong medication.
I like the way you said keeping patients at home as long as possible in some type of independent living. We've definitely seen our packaging program where they get their meds organized and sorted for them. It can keep patients at home months longer than if they're just in regular vials, because I think it's clearer to people. And sometimes when family is involved, it gives family peace of mind that, hey, this is taken care of, it's all set and ready to go.
True, because honestly, it's not only visual issues, trying to read the bottles and is this the right medication? It could be the fact that even the forgetfulness too, part of it. So it's easier to keep tabs on whether the morning or the evening or the lunch meds were taken.
What I think is so funny is people are hesitant to say, I forgot to take my meds, but even like if I get prescribed an antibiotic that's a 3 times a day antibiotic, the number of times that I go, did I take that morning dose? Did I remember that lunch dose?
The same thing.
It's really funny. We have so much trouble admitting, oh, this is hard to remember, or oh, this must be a senior issue. And it's really not.
It is really not.
Yeah. Whether you're 70 years old or 30 years old, life is busy and it is hard to remember to keep track of that, even when we know that it really matters. So,
and honestly, the day in and day out of the same routine, you're like, was that today or was that yesterday?
Yeah, for sure. One thing that I think is like just really interesting about Kim and her job, and I think she's really kind of downplaying this here, is she has so many resources at her fingertips. And she mentioned earlier like just Meals on Wheels and reaching out to different parts of the community. Kim's a problem solver, and that is really awesome, and it's so great to have in our community. I'm not joking. It's really awesome to have somebody in the community that's really patient advocate, right? Like really just kind of like, what does this patient need? How do we take care of that? Tell me your favorite problem to solve, or your favorite thing that's happened that's like, I've got this. I will handle this.
Yes, one of my biggest challenges, and I definitely have in my Rolodex, when I go in the hunt, if it's specialized equipment, sometimes it's, maybe DME, durable medical equipment, things like walkers, nebulizer machines, modes, wheelchairs, wide commodes, definitely specialized things. For instance, a few weeks back, our therapist, during her eval, she felt that the walker was too big for the patient and wanted to see if we could find either a pediatric walker or a small adult walker. So, trying to call around to the companies, I was unsuccessful in trying to find that type of description. And actually calling Bray Shears, and I said, right away, I said, oh, we can get that. I was like shocked. I think it was the whole 2 minutes it took to get that answer. And you guys quickly got that walker in. I want to say it was within a day or two, because it was not long at all. And the price was reasonable. It was like around $30 or $35. I was just quite shocked. And that's typically the experience I do have with Bray Shears when I'm looking for those hard to get items. Nebulizer machines have been a challenge, especially during COVID, trying to find. They were short supply.
They sure were.
And there was definitely one occasion I was able to, when everyone else was sold out, I was able to find that equipment here. So it's just, you guys are definitely a valuable community resource I use often. It makes me look like a rock star, but it's really you guys. It's really
So
Brae
funny.
Shears.
Did you see that walker, by the way? It's so cute.
It
it's
is.
Teeny tiny.
It's so super cute.
It is a cute walker. But obviously not for everyone. This was probably a pretty tiny patient.
Yes, it was a high. So then the patient was pretty cute too.
Yeah,
That's
awesome.
Size, so.
Something that I really, maybe I love it or maybe I'm just not good at it. I hate saying no, I can't do that. And so I think that's what like happens is people will call and be like, I need this really weird item. And I'm like, let me pull out my 5 books here and see if I can find this really weird item.
It is so true.
Yeah.
I feel like you guys just have a stockpile and know right off the bat because you make it look that easy.
I think that's just what we like to do. I think actually we probably have that in common. We're problem solvers and we just like to get it done. So I think one of the unique things that we have when we're talking about our senior population is keeping people as independent as possible for as long as possible, keeping them in their homes, keeping them mobile, keeping them able to do their activities of daily living. And I was reading a book lately on this topic, and there's a new word in kind of like, I don't know, it's really a medical word, but more as like a health conscious word, and the word is health span. And health span is basically like, even though we're living longer, we're talking about lifespan, even though we're living longer, are those last years quality years? And so our goal shouldn't be just to extend our lifespan, it should be to extend our health span, extend our healthy years, extend our years that we're independent, extend our years that we're able to do all the things that we love. Yeah, exactly. Do the things
as
we
much
love.
as you can enjoy. And one of the things I see a lot with our elderly, they want to stay in their homes as long as possible. It's a dignity thing. It really does take a jab at them when they're no longer can stay even in their independent living where they just have minimal supervision, someone checks on them. They want to stay in their apartment as long as they possibly can. So we try hard to make that happen as long as possible with different resources.
Yeah, absolutely. The same thing. And I think that's why we stock a lot of the things that we stock, whether that's commodes that you mentioned earlier, the wheelchairs, the walkers. It's really about keeping people healthy as long as possible.
And independent. I had a lady come up to me and ask me, she wanted to be able to do her own eye drops. She recently had cataract surgery, and it requires a lot of eye drops, as we know, as they're healing, and she just wasn't getting it right there. So looking around, I called Brae Shears, making my phone calls, checking and seeing what kind of devices would help. You guys had this little cup. It fits right over their eye. You put the bottle right in the middle. It's right over their eye, and she was able to give herself her own eye drop, and she was so thrilled.
Yeah. It's called an eye glide, and the reason it works, I've tried it before because it's really weird looking. It's like this teal colored cup, but it's once you put it on your eye, it's like dark inside, so you don't know the drop is coming, so you can't blink. Isn't that cool?
Yeah, it was kind of interesting, and she really, it took her a moment just to figure out where it needed to sit, and when she figured that, she got it every time. So and she was ecstatic, and so was her eye doctor. So she was making her drops.
Yeah, definitely love having those hard to find items. And sometimes, what I would tell if I had to tell patients something, if you are having, I bet you feel the same way. If you are having a problem, it's okay to ask, like, hey, is there a product for this? Is there some, it's not a dumb question, like, how would you know? No. Like, you don't know if you don't ask.
Right, exactly. I'm learning about different resources that we have in this community that I was like, oh my gosh, that's so valuable.
And there's new things every day that come out, so it's not silly to say, do you have a product for this, or can you recommend something for this? So,
right, exactly.
Yeah. Hey, thanks for joining us today. I really love having another organization that I feel has, in a lot of ways, the same mission here in Citrus County, which is just to care for our neighbors, make sure that they have the best health outcomes possible. So I'm really grateful that Kim was able to come and tell us a little bit about Mederi Care Tenders. Tell us the best way for patients to get a hold of you.
The best way is you can give our office a call. Our number is 352-726-3874. We're centrally located in Inverness is our main office, but we service all of Citrus County, and you can simply call if you have questions, you're not sure if we're the right fit for you. We'll direct you the right way.
And tell us again, who is the person that would be calling you? Who are we looking for?
Anybody that we generally see more of the elderly, but anybody who feels they're having some challenges physically, recuperating from an illness, physically needing some extra therapies in the home, and you're homebound. You're stuck in the house. You don't have the transportation. It's really taxing in an effort to get out of your home to get to these things. That's where we can help you and step in and try to help gain your strength, build your endurance, and promote that independence.
Yeah. Keep that health span.
Yes, that's a new word for me today, so I'm going to use that.
Piggybacking on what we were talking about with our hard to find items like that iGlide or that teeny tiny walker, it's so cute. If you have an item or you have something that you're struggling with and you're like, hey, I wonder if they make something for this, give us a call down to either one of our pharmacies and just say, hey, I've got a question about a piece of medical equipment. Is this something that exists? Can you order this? What does that look like? We'd be happy to help you with that.
Honestly, I feel like you'd save some time, make them your first phone call, because guarantee they probably have it or know how to get it.
Thanks for watching.